Let's discuss the factors affecting oral absorption, specifically those related to drug formulation. Firstly, disintegration plays a vital role in how quickly a drug becomes available for absorption. Next, the rate of dissolution determines how fast the drug dissolves in the gastrointestinal tract. Excipients, or additives, can influence absorption by affecting the drug's stability and solubility. Molecular weight impacts the ability of the drug to pass through biological membranes. Lipid solubility is crucial for drugs that need to cross lipid-rich cell membranes. Stability in gut contents ensures that the drug remains effective until absorption. Finally, the pK of the drug affects its ionization, influencing how well it is absorbed. Now, let's explore factors affecting oral absorption related to the patient. Firstly, the state of the absorbing surface can significantly impact drug absorption. Specific factors such as the health and condition of the gastrointestinal lining play a role. Secondly, surface area is crucial. The rate of absorption from the intestine is greater than from the stomach, due to the larger intestinal surface area available for absorption. Next, let's examine third factor, pH within the gut. Weak acidic drugs are primarily absorbed in the stomach due to the acidic environment. In contrast, weak base drugs are absorbed in the intestine, where the pH is more alkaline. Drugs that are destroyed by gastric juice, or irritant to the stomach, are often administered in an enteric-coated form, to protect them until they reach the intestine. An example of this is sodium salicylate. The fourth factor is the rate of dissolution and gut motility. The absorption of a drug in solid form is highly dependent on its rate of dissolution. A higher dissolution rate can lead to increased absorption. Sustained release formulations are designed to prolong the duration of drug action by controlling the release rate over time, ensuring a consistent therapeutic effect as indicated by the time intervals T1, T2, and T3. Decreased gastric emptying can influence drug absorption differently based on the dissolution rate of the drug. For slowly dissolved drugs like digoxin, decreased gastric emptying can increase absorption. Conversely, for rapidly dissolved drugs like paracetamol, absorption may decrease under the same conditions. The fifth factor affecting oral absorption is the presence of other substances within the lumen. This includes interactions such as food, calcium, and iron, decreasing tetracycline absorption. Fatty meals enhancing grisofulvin absorption. Grapefruit juice increasing the oral bioavailability of some drugs. The sixth factor affecting oral absorption is the first pass effect, pre-systemic metabolism. This process involves, first, buccal mucosa. Some drugs can be absorbed through the buccal mucosa, bypassing the first pass effect. Second, portal vein. Drugs absorbed from the gastrointestinal tract enter the liver through the portal vein. Metabolism in the liver, hepatic metabolism, HME, can significantly reduce the concentration of active drug before it reaches systemic circulation. Third, the rectum can also play a role in bypassing the first pass effect. Drugs administered rectally may avoid significant hepatic metabolism, allowing more of the active drug to enter systemic circulation directly. This is particularly useful for drugs that are heavily metabolized in the liver when taken orally. Examples: benzylpenicillin, susceptible to degradation in the stomach and liver. Insulin, broken down by digestive enzymes, requiring non-oral administration. Tyramine, metabolized by mucosal enzymes. The first-pass effect can impact the bioavailability of drugs, necessitating alternative routes of administration or dosage adjustments. To overcome hepatic first-pass metabolism, there are 4 primary strategies. Increase oral dose. This approach is used for drugs like propranolol, where the dosage is increased to compensate for the loss during first-pass metabolism. Use other routes, intravenous administration, for drugs like lidocaine, bypassing the liver entirely by direct entry into the bloodstream. Sublingual administration, for drugs like nitroglycerin, where absorption occurs directly into the systemic circulation through the mucous membranes under the tongue, avoiding the liver. Rectal administration, this method can partially bypass the liver, allowing more of the drug to enter systemic circulation directly.